Good day, everyone. My name is Ibrahim Ahmed Oroki. I'm here this morning to take you NSC 517, which is Contemporary Issues Community Health Nursing. Now, these are our course description. So, this course provides an in-depth explorations of contemporary issues facing community health nursing today. And this course is being designed for nursing students and also practicing nurses. Now, course objectives. At the end of this course, you should be able to know all these things. You should be able to identify the emerging and re-emerging issues or diseases in the community. You will describe the possible measures to control them and also explain or define what culture is all about. Describe the meaning of cultural diversity and its significance for community health nursing. You will to describe the meaning and effects of ethnocentrism on community health nursing practice. At the same time, you will to identify 5 characteristics shared by all culture. You should be able to conduct a cultural assessment and apply transcultural nursing principle in community health nursing practice. Now, by introduction, um, as we all know that nursing profession is always changed to meet the demands of healthcare systems and society at large. Now, emerging and re-emerging illness pose serious problems to public health, stemming from a combination of variables such as environmental changes, human behavior, alterations, and globalizations. Now, I'd like to define to you what emerging disease is. Emerging disease are those diseases that have never happened before and they are now coming out, happening now at first time in a particular population. It never existed before, it's now existing for the first time now. That's what we call emerging disease. Now, re-emerging disease refers to diseases that have been prevented, prevented before, or due to one reason or the other, disease is now coming up again. That is when we cannot talk of re-emerging diseases. Now, the next I would like to take you is factors. Factors contributing to emerging and re-emerging. Why? Why are some of these problems coming up? Those that have been prevented before, those that have gone, why are they coming back? One of the reasons is globalization, urbanization. We are trying to, move or civilize from urban area to, rural area to urban area. There are some factors, there are some things that happens during these changes. Now, environmental changes too. You are moving from one area to another. You are moving from one environment to another. This thing can break this kind of issue. Antimicrobial resistance. You have been taking particular drugs for particular disease or infection. So when the infection have gained resistance to particular drugs, so it can lead to re-emergence of that kind of disease. Now, socioeconomic factors as well, whether where people live, what they are eating, and so on and so forth. And behavioral factors and lack of vaccinations. If they don't take vaccine, it can lead to emergence of one or two disease later in the future. Now, common emergence and re-emerging infectious disease. As it was rightly said, that infectious disease spread from one person to another. An emerging infection may be a new disease like COVID-19, like that. So why re-emerging infectious disease come back after being mostly controlled? So this follows an examples of emerging or re-emerging diseases. We have on my list here, I have COVID-19, Zika virus, Ebola virus disease, tuberculosis, measles, Candida auris, mpox, and whooping cough, to mention a few. Now, possible measures to control them. How can you control them? Surveillance and monitoring. You have to monitor them. How are they multiplying? Where did they start from? So you'll be able to know how to prevent it, how to control it. You have to surveillance. You have to monitor it first. Now, vaccination, giving of vaccine can prevent it. Public awareness and education. Sometimes ago, during this COVID-19, they create an awareness on how this thing transfer from one person to another and how to prevent it or how to reduce it. Now, also interdisciplinary approaches. Before we can control this infectious disease, is not the work of a community health nurse alone. It requires other team members. They have to come on board to fight this disease together. You have to strengthen your health system, get a lot of gadgets, equipment, before you will be able to control these infectious diseases. Now, there are a lot of health agencies that helps involves in action that's related to issues like this in the health of the populations. One of them is World Health Organization, Center for Disease Control and Preventions. UNICEF is one of them. So National Institute of Health, European Center for Disease Prevention and Control, Health Resources and Service Administration, Food and Drug Administration, International Federation of Red Cross, Crescent Societies, and World Bank. Now, culture, as the name implies, culture is a complex and multifaceted concept that encompasses the beliefs of a particular place, value of a particular population, norms, customs, behaviors, and the artifacts that characterize a particular group. What is the way they do, the way they eat, the way they speak, the way to so many things that they are doing together. Now, this is my components of culture. We have components, we have their belief in particular things. When something happens to them, what is their belief in it? Okay, if you're a Muslim, how? Your belief as a Muslim, something is happening to you, you say, by God grace, it will be fine. If somebody say, don't say by God grace, you better go and put it into actions. And like that's your belief, your values, your norms, your rules and regulations, your customs, what are things you must do, what are things you must not do, your traditions, and like that. Now, what are the responsibilities, the roles and responsibilities of a public health nurse? So public health nurse play very vital roles during any management of emerging or re-emerging issues or diseases. This is done by integrating nursing practice with public health principles. These unique positions allow them to address health challenges at the community level while working to promote overall health and prevent diseases. Now, these are the roles and responsibilities. Surveillance, as I mentioned earlier, surveillance, data collections. You get how many tuberculosis cases do we have? How many lentiviral patients do we have? You have to get data. Community education and outreach. You have to educate the community on the means of spreading of these diseases, how they can contact them, how they can prevent them, how they can reduce them. Advocacy and policy development, core coordinations and case management. You have to help, you have to assist in management of these cases, emergency preparedness and response. You should prepare, be ready. The moment they said this case has started, you should be ready to take care of it. Now, research and evaluation. The research will enable you to know the baseline, how to treat any new emerging case, and like that. Now, my conclusion. Public health nurses are essential in managing emerging public health issues through their multifaceted roles in surveillance, education, advocacy, care coordinations, emergency preparedness, and research. This contribution helps mitigate the impact of health threats and promote community well-being. As it was said in the previous class, if you're having clarifications from this our topic, you have right to drop into my box, or you drop it to my mail. So I'll be sending you some other courses. Topics as time goes on. So if you need anything, please feel free to ask me. Thank you and God bless you. Have a nice day.